all believe in the American way. That includes competitiveness. And that will help lower these incredible rising costs. All of the greed that's involved since the year 2000, 400% uppage in profits in the healthcare insurance industry. And that's what we're saying here today. With all the suffering out there, senators, hang tough. We need the public option at a minimum to cause meaningful healthcare reform. We're the only country in the world that's a developed nation that does not have healthcare for all. Nobody's screaming that we're turning into socialists if we provide education for all. No one is screaming that we're turning into socialists if we provide police protection, fire protection. No, there are human rights out there, and health care. Everyone else in the world has deemed it a humane right. It's time for us to figure out how to do it. Let's turn the U.S. of A back to the U.S. of A and not let it be the U.S. of G, the U.S. of greed any longer, as one of my doctor friends says here, anonymously.
My first cause is I've been on a waiting list for 15 years, and now my services came to a stop, or cut. My services were cut in half. I was waiting 15 years from Carmel to get services, and my services are cut, and sometimes I have to stay home because my services were really demolished, cut in half. And another thing, my husband was a fireman for Lockheed Martin, and he fell off a fire truck, and he on the line of motion, and now his services were cut because now we used to have Pacific Care for our primary insurance, and now we have Medicare for our primary insurance.
We were promised that someone was going to try to make a difference, and every day I read a little bit more about how, well, we can't do this because of the compromise here. I realize that Washington is like running in sand. I realize that. But when do people quit thinking about the lobbyists that are spending billions of dollars on influencing them and spending that billions of dollars on helping people get well? What's more important? There's not going to be anybody left. I have to pay for a certain percentage for the Procris shot. The insurance company won't pay anything unless my blood level is at a certain point. If I'm at borderline where I just barely function, they say you don't need it. So I have to wait for a week or two till I drop down. Then I can get the shot. So my quality of life sucks. That's all there is to it. And why is it that they have the right to keep me alive, barely, but they don't allow me to function in society? And I'm paying for this. I am paying insurance premiums for this. And all of a sudden, I'm cast aside. I feel like I'm at the dog at the Humane Society, waiting in the kennel to be put down. That's not right. When we become the country that we dreamed of with our Constitution, you know, the wonderful moving paper fantasy about everyone being equal, everyone having rights, everyone you know, for the benefit of our posterity. Our posterity doesn't have a future right now. We're not offering them a future. We're asking for the future. We're asking you guys to do what we sent you there to do.
The election's over. We've sent you guys to office, so now you have to deliver. That's where it is, and you don't get to stall, and you don't get to tell us that, well, you know, we have to make a compromise. What, compromise with the people who are taking, with the insurance companies that are taking 30% of all medical expenses and just keep keeping it to themselves, and now we have to compromise with them? I mean, we have to decide that, well, maybe they should keep their 15% of all medical costs. I mean, why? Why should we compromise at all? Why shouldn't they be gone? What are they doing? They're not providing health care to anybody. They're only administrating, and you're demonizing, you know, a public option, saying that the government couldn't do this with a much smaller overhead. In Europe, I think it's something like 5% or even less of an overhead. So let's get rid of the 30%. I don't see why you need to be saying we need to compromise. We have to compromise here.
The other issue is that a lot of people say don't tamper with my health insurance, but the implicit message there is, I've got mine and I don't care what happens to you. And I think in this country that is unacceptable. We ought to be able to share a little bit. I'm an older person, not yet on Medicare, but if it requires that my husband and I pay a little bit more in order to keep Medicare functioning, plus extending coverage to more people, then that's our responsibility to do that. If you have a little more, you ought to pay a little more.
No, people are dying for those stories. They don't want to do that anymore. You guys and Obama led a movement for change, and now we want it. We want it.
Right
That's
on.
it.